Hi, I'm Dr. John Stanton again. I want to talk a little bit today about carpal tunnel syndrome. Now, carpal tunnel syndrome is not one of the most difficult things we do here in orthopedics, but it tends to be one of the most common. Carpal tunnel syndrome is a condition in the hand where the patient loses feeling predominantly to the thumb, index, middle, and part of the ring finger. There are three nerves that go into the hand. The median nerve, which is the largest of the three, is the one that's involved in the carpal tunnel syndrome. On my hand here, I just want to show you what the anatomy is. The median nerve passes through the middle of the hand, underneath a band that connects the muscles on the small of the hand to the base of the thumb. This tight band here passes over the top of the median nerve, and the median nerve supplies a sensation to this part of the hand. Thumb, index, middle, half of the ring finger. A separate nerve, the ulnar nerve, passes up and goes to the little finger. A branch of that same nerve comes around the back of the hand and goes to the back of the little finger and half of the ring finger. The radial nerve, which is the third nerve, comes up the forearm here and goes to the back of these fingers here. So the doctor will specifically want to know which fingers are involved and whether the numbness is continuous or whether it's just caused by certain activities. Carpal tunnel syndrome can be treated with a brace to limit the movement of the wrist, anti-inflammatory pills, and occasionally an injection of cortisone down into the wrist. The tight band that comes over the wrist passes over the top of that nerve. Additionally, there are 9 tendons, the tendons to the fingers, that pass behind that nerve. If these tendons become swollen, they will crowd the nerve and cause compression of the nerve, which is the carpal tunnel syndrome. As mentioned before, a cortisone shot can help improve that inflammation in the tendons and cause the symptoms to subside. If we're not sure that you have carpal tunnel syndrome, or if we think the ulnar nerve may be involved as well, we will have a neurologist, such as Dr. Rabinowitz, who works here in this office, do a nerve testing to evaluate the speed at which the nerve impulse passes over a set distance. If that speed of the transmission of the nerve is slowed, we know the nerve is compressed. Carpal tunnel surgery, as mentioned, is one of the easier surgeries we do here, and it's done through an incision about this long. Basically, we cut through the skin, we cut through that tight band, inspect the nerve, and then sew the skin up. If there's any narrowing or thickening of the nerve, we may release the outer covering of the nerve, but we very seldom have to do that. Basically, all that has to heal when we're done with the surgery is the incision. And like any other cut, it takes about two weeks for that to heal. At the end of 12 to 14 days, the stitches come out, the hand can get wet, and by 3 weeks, you can pretty much do whatever you want with the hand. Occasionally, a patient will need physical therapy, but that's pretty rare. Please check out our website to see what other things we have to offer here at the Bone and Joint Group. We're glad to have you checking out our website, and come by and see us. Thank you.